Hello everyone, I'm Dr. Pavan Prasad. Today, I want to talk about a cancer that is curable, preventable, detected early, that is cervical cancer. In India, we lose one woman every 8 minutes for a very preventable cancer, that is cervical cancer. Now, what is cervical cancer? The cervix is the lowermost part of the uterus that opens into the vagina. Cervical cancer occurs when abnormal cells grow uncontrollably in the lower part of the cervix. What are the risk factors for cervical cancer? The most common etiological factor for cervical cancer is human papillomavirus infection. It is a very common viral infection which every person can get in their day-to-day life. The only thing is, our body's mechanism has a way to eliminate the virus. If due to various reasons the virus stays in the cervical part for a very long duration, it starts growing over a period of say 10 to 15 years and causes cancer. The golden thing is, we have an opportunity to detect the cancer at a very early stage, target it and cure it completely. Like I said, among the risk factors in cervical cancer, we have human papillomavirus, which is the most common cause for cervical cancer, followed by multiple sexual partners, early age at marriage, poor perennial hygiene, smoking, alcoholism. All these factors contribute to development of cervical cancer. What are the symptoms of cervical cancer? Early stage doesn't have any symptoms. Even if a person feels absolutely fine, she can have cervical cancer. So screening is the only method through which we can target the cancer at a very early stage. Coming to symptoms, the most common symptoms which we see in our day-to-day practice are purulent vaginal discharge, bleeding in between periods, bleeding after sexual intercourse, perineal pain. All these symptoms occur when the disease is advanced. So I would strongly recommend every lady to get herself screened, because the disease per se is asymptomatic in the initial stages. Now, what about screening? What is cervical cancer screening? Any woman between 30 to 65 years of age has to undergo cervical cancer screening with your gynecologist. Now, what does the gynecologist do? She examines the lower part of cervix and the vagina and takes a pap smear, which is a painless procedure. And if there are any abnormal cells within the cervix, this can be picked up early. Now, who should be screened? So, any lady between 30 to 65 years of age can undergo cervical cancer screening. Ideal is between once every 3 to 5 years. If there are risk factors, of course, frequent screening is required. Can cervical cancer be cured with vaccination? Yes, cervical cancer is one of those vaccine preventable cancer which have a very good response rate. Meaning to say, even before a patient is exposed to the virus, if she is vaccinated, then definitely she can be prevented from getting cancer in the future. Now, who should be vaccinated? All girls between 9 to 15 years of age, that is, even before a lady presumes her sexual activity, vaccination is advisable. Now, can a woman who is above 30 years take vaccine? Yes, of course. It prevents the viral load from multiplying further. Now, there are a few myths associated with cervical cancer vaccine. People feel that cervical cancer vaccination can cause infertility. No. Scientific evidence has proven that vaccination has got no impact on fertility. But is vaccine alone sufficient to prevent cancer? Vaccination along with screening offers a benefit. Vaccination alone definitely has an effect on preventing the viral load, but vaccination with screening can detect early changes and help us to treat disease more effectively. So remember, cervical cancer is one of the most preventable gynecological cancers. So we have to educate our women, make sure that there is no social stigma associated with the disease, and there is no hesitation in seeking medical advice, and simultaneously we have to make vaccine available to all of them. So let us take this pledge to protect the women in our lives and prevent this horrible disease called cervical cancer. January happens to be Cervical Cancer Awareness Month. So let us do our part in preventing cervical cancer and, of course, eradicating this disease once and for all. Thank you. Stay strong, stay healthy.